Feline cholangitis, a serious inflammatory disease of the bile ducts, presents significant challenges in feline medicine. This complex condition, often referred to as cholangiohepatitis, directly impacts the liver's ability to function properly. The term cholangitis itself provides insight into the condition, with chol referring to bile, angi indicating vessels, and itis signifying inflammation. Therefore, feline cholangitis involves inflammation of the bile ducts, crucial pathways that transport bile from the liver to the gallbladder and small intestine. The epidemiology of feline cholangitis remains an area of ongoing research. While the exact prevalence is not definitively known, studies suggest it is a relatively common feline liver disease. Middle-aged to older cats appear to be more susceptible, and there is no clear breed predisposition. The classification of feline cholangitis further clarifies its diverse nature. Neutrophilic cholangitis, characterized by the infiltration of neutrophils, a type of white blood cell, into the bile ducts, is the most common form. Less common forms include lymphocytic cholangitis, marked by the presence of lymphocytes, and sclerosing cholangitis, which involves scarring and thickening of the bile duct walls. Understanding the terminology, classification, and epidemiology of feline cholangitis provides a foundation for veterinary professionals to effectively diagnose, treat, and manage this complex and often frustrating disease. The clinical signs of feline cholangitis are frustratingly nonspecific, often mimicking other common feline ailments. Recognizing these subtle clues is paramount for early diagnosis and intervention. One of the most frequent signs is jaundice, a yellowing of the skin, gums, and whites of the eyes, indicating a buildup of bilirubin in the bloodstream. Loss of appetite, lethargy, and weight loss are also common, reflecting the systemic impact of the disease. Gastrointestinal upset may manifest as vomiting and diarrhea, often attributed to reduced bile flow and impaired digestion. In some cases, cats may present with abdominal pain, detectable as reluctance to be touched around the belly. The etiology of feline cholangitis remains an enigma, with multiple factors potentially contributing to its development. Ascending bacterial infections, migrating from the intestines to the bile ducts, are implicated in some cases. Immune-mediated mechanisms where the body's own immune system mistakenly attacks the bile ducts are also suspected. Underlying diseases such as pancreatitis, inflammatory bowel disease, and intestinal lymphoma can predispose cats to developing cholangitis. In many instances, the exact cause remains elusive, classified as idiopathic cholangitis. Diagnosing feline cholangitis presents a significant challenge, requiring a multifaceted approach that combines clinical suspicion with targeted diagnostic tests. A thorough medical history, including the cat's age, breed, lifestyle, and any previous medical conditions, provides valuable clues. Physical examination, focusing on signs of jaundice, abdominal pain, and overall body condition, is crucial. Blood work forms the cornerstone of diagnosis. Elevations in liver enzymes, particularly alkaline phosphatase and gamma-glutamyl transferase, suggest cholestasis, a reduction or blockage of bile flow. Increased bilirubin levels confirm jaundice, while alterations in other liver parameters, such as alanine aminotransferase and aspartate aminotransferase, indicate liver cell damage. Imaging techniques play a pivotal role in visualizing the bile ducts and surrounding structures. Abdominal ultrasound, a non-invasive and readily available modality, can detect bile duct dilation, thickening, and the presence of stones or masses. More advanced imaging, such as computed tomography or magnetic resonance imaging, may be warranted in complex cases. Section 4. Treatment modalities. Treating feline cholangitis necessitates a multimodal approach, tailored to the individual cat's specific needs and severity of disease. Medical management forms the mainstay of treatment, aiming to reduce inflammation, combat infection, and support liver function. Corticosteroids, potent anti-inflammatory agents, are often prescribed to suppress the immune response and reduce bile duct inflammation. Antibiotics, chosen based on suspected or confirmed bacterial involvement, target ascending infections. Ursodeoxycholic acid, or UDCA, a bile acid, improves bile flow and protects liver cells from damage. Nutritional support is paramount, as cats with cholangitis are often malnourished and anorexic. Appetite stimulants may be necessary to encourage eating, while highly digestible, low-fat diets minimize stress on the compromised liver. In severe cases, nutritional support may involve placement of a feeding tube. Surgical intervention is typically reserved for cases where medical management fails, or if an obstruction, such as a bile duct stone, is identified. Section 5. Monitoring and prognosis. Monitoring the progress of cats with feline cholangitis is essential to assess treatment response and guide adjustments as needed. Regular blood work, typically every few weeks initially, allows veterinarians to track liver enzyme levels, bilirubin, and other blood parameters. Clinical signs such as appetite, activity level, and jaundice should be closely observed and any changes reported promptly. Repeat imaging, such as ultrasound, may be recommended to evaluate the bile ducts and surrounding structures. The prognosis for feline cholangitis varies depending on the underlying cause, severity of disease, and individual cat's response to treatment. Neutrophilic cholangitis, the most common form, often carries a good prognosis with appropriate and timely intervention. Lymphocytic cholangitis and sclerosing cholangitis tend to have a more guarded prognosis. Factors associated with a poorer outcome include severe liver dysfunction, persistent jaundice, and lack of response to medical management. Early diagnosis, aggressive treatment, and dedicated nursing care significantly improve the chances of a positive outcome. Section 6. Prevention and client communication. While preventing feline cholangitis completely may not be feasible due to the complex and often unknown etiology, certain measures can minimize risk and promote overall liver health. Vaccinating cats against infectious diseases such as feline leukemia virus, FeLV, and feline immunodeficiency virus, FIV, which can predispose to secondary infections, is crucial. Maintaining a healthy weight through a balanced diet and regular exercise reduces the risk of obesity-related liver disease. Promptly addressing any gastrointestinal issues, such as vomiting, diarrhea, or changes in appetite, can prevent ascending infections from reaching the bile ducts. Client education plays a vital role in the successful management of feline cholangitis. Clear and compassionate communication about the diagnosis, treatment options, and potential challenges helps owners make informed decisions. Explaining the importance of medication compliance, dietary modifications, and regular veterinary checkups empowers owners to actively participate in their cat's care. Providing support and resources, such as online forums or support groups, can help owners cope with the emotional and financial challenges of managing a chronic feline illness.